The acronym API stands for Asian and Pacific Islanders. In the beginning, in the early 80s and 90s, APIs were categorized as other. So we actually had no data to understand the impact of HIV in our communities. But we knew what the impact was because we were seeing our friends and family members get sick and die. And that's why so many organizations like API Wellness in the day rose up and folks created these organizations to take care of their community members and to work with the CDC and other federal departments to make sure that we were being counted. Currently, the infection rates, when we look in total, APIs make up maybe 2% of the cases compared to other communities of color, other communities in general. We are still a small fraction of the epidemic, and yet this is always our charge, is that just because we make up a small fraction doesn't mean that we can be ignored or that resources should not be allocated, because that's exactly what will drive the epidemic even further. The Asian and Pacific Islander term makes it seem like we're a monolithic community. And in fact, we are dozens and dozens of communities and cultures and nationalities, ethnicities, upwards to 50 and beyond, inclusive of different languages, 50 different languages and more. And so when we're organizing and working together, that does definitely pose challenges because we can never represent the fullness of the many communities and languages and cultures that we're working on behalf of. And yet, it does allow us to do the advocacy on behalf of the communities. And it has been effective over the years so that we can set priorities, we can demand resources and funding for the needs of our communities at all levels of government. The different languages and cultures that we have to address when we're doing HIV work is of course a challenge. It's inherently a challenge. If we've learned anything around responding to HIV is that we do what it takes. And so maybe we don't get every brochure or every fact sheet translated into every single language, but we hire folks, we train community members. So what we've done is really try to harness the power of the individuals in communities and to be in community with them, to empower them to tell their story and to be the ambassadors and the boots on the ground folks to do this work. The biggest challenge is the stigma and discrimination and shame that so many of our community members and our families are grappling with. Shame with respect to our families, our parents, our siblings, our aunties and uncles and grandparents, the connection that we have to our family members is so vital. And so when we are cast out, when we are disconnected or abandoned because of our HIV status or being queer, that has a profound impact. And that drives so much of why there are such deep risks in our communities that we need to address around not just HIV, but greater health issues, behavioral health issues, mental health issues. And so I think all of that is so important that we begin to talk more and more about. And what we have done at San Francisco Community Health Center, formerly API Wellness, has really tried to understand the epidemic of stigma, not just at the individual level, but really a community level. Like, how can we change norms? How can we actually heal communities that have been so broken because of the shame of HIV, which has propelled, which has caused folks to not get tested, which has caused folks, when maybe they are diagnosed with HIV, that they disconnect from their family of origin. In our API communities, it is difficult to talk about sex and sexuality. What I've seen is when we're able to provide a group, when we're able to share information amongst peers, that actually there is such a desire to talk about our sex lives in an intimate way. And so it's about creating the environment and creating the openness. There is a persistent myth that Asians and Pacific Islanders are a model minority. So model minority for me as an API means that I am the perfect son. I am going to be the perfect science or math academic person. I will do well in everything and succeed. And so the unattainable perfectionistic kind of expectation, it just sets us all up to fail. And what I have seen is this just does disservice when we are trying to address health needs, HIV. It doesn't capture the folks who are struggling as immigrants or undocumented folks. It doesn't capture the folks who are monolingual in a language that is not English. And so we are constantly trying to break down that myth. San Francisco Community Health Center, formerly API Wellness, I do think we started some of the first programs that addressed HIV in the API transgender community. In the 80s and 90s, we had some of the most amazing programs that were about peer leadership and mentorship, peer educators in the community who were API trans women and fierce, fierce women. And those programs were models for other programs throughout the country, and I'm so proud that started here. This organization, San Francisco Community Health Center, and dozens of organizations across the country wouldn't have existed if it wasn't for the early activists. In the 80s and 90s, there were dozens, I want to say over 20 different organizations that came about, and all throughout, from Hawaii and the Pacific through the Midwest and the East Coast. And we actually needed to work together. We all knew each other. We had to share ideas. We had to share our strategies. When we were serving our community members, we had to provide, we were their chosen family. We had to provide a home, and whatever that means to folks. But that means not just an HIV test, but it means support. It means hand-holding. It means being a shoulder to cry on. It means helping folks through navigating their world. And to me, that was the strength of what the API HIV organizations did. We knew how to take care of the whole person, and that's what we had to do. I do think that is the uniqueness that we brought to this work, and why we're able to continue to thrive and grow and expand.